welcome to the Red Chair series. Today we're talking to Dr. Julia Joseph DiCaprio, the Chief Medical Officer with UCare. The Red Chair series is an opportunity for us to talk to C-suite and the insiders and the sort of the people that are driving the vision, the mission and the values of the carriers that represent the clients that you represent. So here today we're asking some questions of Dr. Julia and hopefully give you some more insights as to the future and where UCare is at. So welcome to the Red Chair series, Dr. Julia.
Thank you, Richard. Good to be here.
Great. Well, so the first thing is tell us a little bit about yourself and what's your journey been to, so you're an MD.
I'm an MD,
and,
yes.
so you've worked a lot in pediatrics, so children must be an important part of your life.
Yes, and I also have a specialty in adolescent medicine. I love taking care of teenagers.
Great. So that's going to be perfect for our agent. But so tell us a little bit about your journey to UCare, about yourself.
Well, thank you for the question. From the time I started in medicine, I was always interested in the context in which people existed. And it was probably that plus my public health training that allowed me to develop an interest in the health of populations.
Yes.
And so I've always been committed to that. And when you think about my role at UCare, where we're dealing with the health of all 550,000 of our members, that truly is addressing the health of a large population and the health of individual populations within that larger group. And so it was that interest that brought me to UCare.
Great.
In fact, the other piece that brought me to UCare is I've always been committed in addressing the barriers that people face between where they are and where they want to be in terms of optimal health and wellness. And UCare has, in its history, this is what we do, is take care of people who might, of all sorts, including folks who face the greatest barriers to health. And so that's why I was attracted to UCare and started there October 1st, 2018. 2018,
okay, well, so you've had some time under, so we should be able to lift the hood on UCare with you today, so I'm looking forward to that. You know, it's interesting that there you are as a medical doctor and seeing that opportunity that you can bring your sort of values and what you want to service to, say, 550,000 people and maybe more in the future with UCare. So you can bring, it creates the ability for you to bring to scale things that you could only do one-to-one as in practice, I suppose.
Yes, exactly. You put your finger right on it. That's actually what we do at UCare and why I love working there, is it allows me to translate what I do as a physician caring for an individual patient to what that same sort of care and commitment to groups of people. I oftentimes describe the health of populations as being, we care for patients without the patient's needs, so S apostrophe, versus as an individual clinician, I care for patients' needs, so apostrophe S.
Got it, yeah, and my grammar's good enough to have got that. I got that.
I'm so happy that I remembered it.
Well done. Well, so so you have some experience as a payer and as a provider. How does that play into combine to support UCare's mission? Because there's always this talk about today value-based care, payer-provider relationships, etc. But in a sense, you started as a provider, and here you're now working at a payer. How does that impact what you do?
It actually impacts it hugely. And I have to say, I still see patients. I'll be in clinic tomorrow.
Really?
Yes.
Okay.
I do clinic about once a month at a clinic in North Minneapolis, which I think allows me to really be connected on an individual level with the types of patients or people, members that UCare serves. And at UCare, we really are committed to partnering with providers. We have such an extensive network as providers, as the agents you work with probably know. And I think as a clinician, it allows me to understand how we can not get in the way of providers doing what they need to do for their patients, our members. And that's a large part of how we determine whether we're bringing value to members. Are we, one of the ways we measure that is, are we not overburdening providers, physicians, nurse practitioners, others, even more, because they have a huge responsibility to our members and their patients.
We're all part of that ecosystem,
yes.
The agents, the carriers, the payers, etc. I've seen over the time that I've been here, just a wonderful job that UCare has done. I'd say, let me characterize it this way. We get agents calling us saying, hey, I need a UCare contract because my client's asking for it. So generally, agents have companies they represent, they understand the value, and they would present that, based off suitability and conversations they're having, of course. But UCare is probably the number one carrier that clients come knocking on agents' doors saying, I want that. And it must be because of the experience that friends and neighbours have had. So what is it you do to have got into that position where you're sort of, to some extent, the most requested carrier?
Yeah, we have such great member retention, and it's because of our partnership with providers. So we have unique products for our members, so partnering with different health systems. So our network is a huge part of it. Other things, we have a variety of plans. Everyone's unique. So we want to make sure that we have a portfolio of plans that will appeal to all sorts of people, and that include benefits that really appeal to the unique needs of the whole population that we serve. Those would be a couple of the reasons, I think, why people come requesting UCare. Probably because they've heard from people that they know that they can get that kind of service. I guess I'd add one other piece as I'm thinking about it, is that unique individual relationship that we have with our members, that we describe ourselves as a people-powered health plan. We are a people-powered health plan. And if you were to interact with UCare, you wouldn't interact with, you know, a recording, or you wouldn't be redirected to our website unless that's what you wanted to go and get, you know, get information electronically. But we do really work to connect individually with our members, and I think that's another reason why people request UCare.
I think people sense that mission. Certainly, I sense it in the power, and just really, really nice people. I mean, I think that you know, who you hire and the values that you have count, and it counts in Minnesota. It counts in with your network decisions and your benefits and how you service people.
You're exactly right. The foundation of it all are the people who work at UCare. And we have very high employee engagement scores. And people, if they're engaged, are more likely to have mastery in their work and be happy in what they do every day. And that's a huge part of why our members that we serve get great services, because the people who work at UCare are very happy. In fact, this is year 12? I don't even remember how many times in a row UCare has been in the Star Tribune top workplaces. And in fact, we rose to being number 10, I believe, in the top workplaces for large companies. And I think that's an indication
That's
of
pretty
how
good for an
happy
insurance company.
That's true. That is right. That is right.
Insurance isn't the number one conversation that most people want to have, so it's wonderful to be in the top 10. So how do you continue UCare's success? You know, the market's changed a little bit. We have for-profit carriers coming in. There's more competition. There's more types of health insurance. You know, there's level funded. There's fully funded. There's other carriers coming in. There's Medicare Save. There's lots of different options. It gets more complicated, more competition. You know, as a small company focused in effectively one market, and obviously in Wisconsin as well. But how do you keep that success? How does David fight Goliath?
Well, that's our differentiator. There's no other company, I would say, that has the connection that we have to providers and to our members. We're a local, community-based health plan. And I think it'd be hard for some of the larger competition or even local competition to say that. So I think the answer to your question is just our unique connection to communities, to local providers, and to our members. There's no one who has that as a differentiator.
So you feel confident about the future of your team, and you're ready for the fight, as it were?
Oh, absolutely. And I think our data has shown we continue to grow and thrive.
Great, wonderful. We are emerging from, 18 months or so of pandemic. You know, I notice, you know, so some of us, you know, don't go into the office. We don't see our colleagues. What people's expectations from health insurance, the way that insurance companies interact, the way that agents interact. What lessons have you learned from the pandemic that we will see changes at the way payers, particularly UCare, will adapt because of our experiences over the last year or so?
Yeah, there's been a huge amount of change and a lot of learnings. I'll have to say that the same way probably the agents that you've worked with had to adapt their work in order to remain connected to the people that they serve. Our team at UCare had to do the same with our members and did it successfully. So we're really proud of being able to grow and thrive in as difficult a year, or as difficult as a year and a half as it's been during the pandemic. What we've learned is the importance of serving people in different ways. So telehealth is an example. Some people call it telemedicine, but
No one was interested in telehealth 2 years ago, were they really? It was there and it was efficient, but that's really taken off, hasn't it?
It has, and it's interesting that you mentioned no one really thought about it a couple years ago. I know that I kind of knew a little bit about it and had some experience with it, but it was really my children's generation that couldn't quite grasp the concept of needing to go in and get care. They were like, well, who do I, where do I search and who do I talk to or, communicate electronically to get care? Well, that all changed last year.
Yeah.
And there's been a huge growth in telehealth and medicine services, and that's here to stay.
Yeah.
I think people realized that they could get care more easily in the comfort of their home. I mean, there's a lot of things people want to go in and see their provider for.
Yeah.
And
well, there's less risk from home. You don't have to think about the kids, the travel, the transport, the time, the waiting. I mean, there's so much more efficiencies, and yet people wanted to go and see the doctor.
And sometimes people still do, and that's what we're going to make sure that we have for our members in partnership with their providers, was that people can get services the way they want to, whether it's virtually or if they decide that they want to go in and get care face-to-face. So that's a learning. We have to make sure that we're serving people different ways.
Great.
The other piece that the pandemic showed us is that we have to really understand, deeply understand, the unique needs of our members. We always had that concept, but the pandemic showed us that some folks were able to do well, even in the more difficult times, are able to get COVID-19 vaccination without someone helping them figure out how to navigate systems, whereas other folks need more support. And the pandemic showed us that our work, which we had set out on way before the pandemic, to deeply understand our members and tailor our services to them, was the right approach. And that's what we've learned coming out of the pandemic.
So we're not treating everybody the same. It's actually just treating everybody as where they're at.
That's exactly it.
Yeah.
And sort of along those lines, the frame that we took is we want to see what we can do to help folks and make sure that they can get care in the normal course of their day. And in essence, make it easier for them. The other thing, I think, the last piece coming out of the pandemic is we recognize that people have barriers to optimal health and wellness. We've always known that because of the mission of UCare and our partnership, not only with providers, with our members, but with their communities. And so we recognize that, again, the work we had in place to help folks surmount maybe a geographic barrier to care was the right approach because people had a lot of barriers last year.
Okay, well, thank you. And finally, as we talk to agents, and you have the opportunity to talk to many agents on this, they are often the first point that connects somebody, a client, with UCare. They do that suitability, they have the meeting, and that they say, well, a combination of network and benefits and affordability and brand and all the rest of it and service, UCare. So it's the agent that makes that first connection. What should the agent know in order to represent UCare better and to educate their clients better about what UCare does?
Well, the first thing I'd like to say to the agents is thank you very much because you're so important and you're a partner to ours. All of you are partners to UCare, so we really are thankful for their work on behalf of UCare. Because when they do work on behalf of UCare, and this is what they know, I think, and this is why people request UCare, when they're doing it on behalf of UCare, they're doing it on behalf of UCare members.
Yeah.
And that really is the core of our work. And I think the other thing is what they see if they're unfamiliar with UCare. I'm sure you continually have new brokers that are working with you. And if they're unfamiliar with UCare, but they hear about things like connections to members, individual members, that connection to providers, being a local community-based health plan, that actually is what UCare is about. It's why people work there, it's why I work there, it's why my team works there, and everything they hear about UCare is true, and we thank them.
Well, LeClair Group, we're a family-owned business, been around 90 years, and I think that been small enough to care but big enough to cope is something that we really think is important. And we see ourselves as a community-based, general agency. So I think that community-based model is very, very strong.
Yes.
So thank you for doing what you do. Any final thoughts for our agents?
Just thank you. I'm sure that you have had as difficult a year. You've had to adapt your work, and we appreciate what you've done to allow our members to continue to get services. And thank you for bringing new members to us. We really appreciate it. And that's, I think, what I would say to the brokers.
Well, Dr. Julia, Chief Medical Officer with UCare, thank you for coming over to Woodbury today and meeting us and sharing your thoughts and vision for UCare. Thank you.
You're welcome, Richard. Thank you.
It's been a pleasure.
Thanks.